So this was a pilot study that we ran and are still running actually at WashU, where the idea was to use Belimumab for prophylaxis of chronic GvHD. And Belimumab is a monoclonal antibody against BAFF and binding BAFF to BCR receptor on B cells. And the idea was that by depleting these alloreactive B cells, we could prevent development of chronic GvHD. And Belimumab is an FDA-approved drug for treatment of lupus and lupus nephritis. So there is dosing and safety data that we are already aware of. So we elected to use the same schedule of dosing, which is 10 milligrams per kilogram, and it's given initially every 2 weeks for 3 doses, and then we are giving it for 4 more doses at monthly intervals. So it ends up being total 7 doses for about 6 months. And we would start it anywhere between day 50 and day 80 post-transplant. So we would establish that these patients are in complete remission after transplant. And patients were all adults with hematological malignancies, and mostly these were AML and ALL, and then few patients with MDS and few patients with lymphoma. And we were planning total of 10 patients, and I presented data on first 9 patients, and the last patient is already enrolled and has been through the first 2 or 3 doses by now. And as I said, so they all had to be in complete remission. They all received peripheral blood stem cell transplant from 10 out of 10 matched donors who could be either related or unrelated. And then GvHD prophylaxis was with methotrexate and tacrolimus, and then we allowed patients to receive ATG. And I think 7 out of 9 of them has received ATG. And the primary endpoint really was to see how they're going to tolerate Belimumab, so safety, and then also to get some information on preliminary efficacy and what's going to happen with their acute and particularly chronic GvHD. So far, I mean, among all these patients, really nobody had 3 or more adverse events. There were no any infusion reactions or hypersensitivity, and also importantly, there were no major infections. There was 1 patient who had CMV reactivation, but there was no significant infection or myelosuppression. So their counts stayed preserved. And as in regards to acute GvHD, 3 patients had very mild grade 1 skin GvHD, and 1 went on to develop like overlap chronic, and 2 completely resolved with a brief pulse of steroids. And then in regards to chronic GvHD, so out of these 9 patients, 8 completed all doses as planned, and we have been following them now more than 20 months down the road. And out of these 8, 5 had no chronic GvHD and are not on any immunosuppression now, 20 months past them finishing Belimumab. And then 2 patients had some chronic GvHD. 1 had very mild to moderate, responded to a little bit of immune suppression, and then GvHD kind of faded away, and he's now on a tapering schedule, I think just on 5 milligrams of prednisone. And the other one had more severe chronic GvHD. He also had a lot of complications from hemochromatosis and fatty liver, and he developed that chronic GvHD about 7 months after he finished Belimumab, and he eventually then passed away from pneumonia and liver failure. But really, those 2 patients were the only 2 who had more significant chronic GvHD. So overall, I think these are promising data. Our correlative studies are really in process because we are waiting for this last patient to be enrolled, but so far just immunoreconstitution is showing that the B cells are depressed a year throughout after transplant. But it will be interesting to see the measures of BAFF and correlate them with B cell levels. Yeah, I think it's going to be interesting, and hopefully we can make it into a bigger study and really see on a larger group of patients how this will play out. But I think the safety here was really, I think, most important to come across, that the drug was well tolerated and that there was no myelosuppression or infections.